Hi, everyone. Dr. Eric Westman here. Happy New Year. And I hope everyone had a wonderful holiday season. Yeah, please chime in the comments there where you're viewing from. We have Michelle from the Netherlands, Facebook user from Australia. Sorry, some of the names don't come in. It just says Facebook user. But we have Australia, McAllen, Texas, California, Buffalo. Oh boy, yeah. I hope the weather wasn't too bad for you, Debbie. Georgia, Texas, Thunder Bay, Ontario, Mississippi, Minneapolis. Okay, whoa. Can't acknowledge everybody, but so again, Happy New Year, and I hope this is a better year than ever for you. And I'm just going to wait just another minute or two. If you've been following what we're doing at Adapt Your Life Academy, you're going to see and hear again at the end that we have open cart for our Keto Made Simple class at the moment. That's we'll talk about that at the end. Okay, from New York, and far away in Tarboro, North Carolina. Welcome. That's just down the street. I'm in Durham, North Carolina. Again, I hope you had a wonderful holiday season. Didn't get caught up too much in the travel and weather stuff that was going on. What I'd like to do is to have you sit back and listen, have a cup of bone broth or tea. Ninian says drinking bone broth. I'm going to tell you a story. And, you may have heard the story before, but that's okay. It gets better every time. The story is one of a transformation of a young doctor, me, going from internal medicine through I think I had really good training. Some of the best medical schools and public, and now at a private university in the U.S., Duke University. And I've really become disillusioned with our current medical care. And no, I don't go out like some of my other colleagues and bash other doctors. I don't find that productive. And I think that isn't my style if you've gotten to know me. Hello from Jakarta. That I have great memories of a trip to the Keto Fastosis conference in Jakarta. But so the current medical care, haven't you kind of realized that it's not really anything to do with food, current medical care? And it as an older doctor now, I realized that food is really critical to good health. I mean, not just important, it's critical. And if there's something I want to impress upon you, whether we can help you at Adapt Your Life or not, Adapt Your Life Academy, it's that what you put in your mouth matters, not only from a addiction, sugar and carbs kind of thing, but just from a general nutritional standpoint and optimizing your bodily functions. Recently, I went into a gas station locally, and I got gas for my car, and it was perfect gas. I mean, it was clean, and I couldn't even get bad gas, for my car, But I go inside where there's this convenience store and a restaurant and all that, and I can buy crap for the human body. We treat our cars better than we treat ourselves and other humans in terms of fuel. And that's really upsetting. Upsetting so much so that I'm going to tell you a story and maybe it'll put into perspective. It's taken me, 30 years now to kind of unlearn what I was taught. It's called a paradigm view. And the first time you hear something like this, of course, you can dismiss it and all that. But I'm faced with this every day in my clinical practice at Duke, where people come in on the best medication care, medical care that we have today, and it's basically all medicines. It's like I spend time just writing out all the medicines people are on, and they're not better. They're just managed with these problems. So bear with me just a minute while I share my screen. And let's see. Oh dear. I think I'm okay. I'm going to go to a slideshow, and just bear with me with that confusion there. So Happy New Year, first week of, or just second week of January. Great time to get started on new lifestyle change or redoubling your efforts. And I'd like to share with you the two pathways, the keto lifestyle versus medication. As a background, if you don't know who I am, I'm a professor of medicine at Duke University, and I'm director of the Keto Medicine Clinic. We started in 2006 after doing 10 years of research, and I've published over 50 peer-reviewed papers on low-carb and keto diets. I'm past president and chairman of the board of the largest group of medical weight loss doctors, the Obesity Medicine Association. I'm co-founder of an education company and book author of several books, including my latest and really the first one I did as a solo author is End Your Carb Confusion. And you can find the latest information about what I have to offer at ericwestmanmd.com. You may have seen me at the Diet Doctor website. Diet Doctor has a huge worldwide presence, and I've taught there through lectures, and basically they've used my videos at different conferences. You may have seen me there. You may have seen me on the cover of Woman's World, and I kind of laughed because I thought the best influence I could get was in a medical journal like the Annals of Internal Medicine and the American Journal of Medicine. I've published in there, but now when I go out to conferences and meet you, personally, many of you have told me that, well, I first heard about you on the cover of Woman's World, and so I don't really, I don't make fun of it. It's just another way to get the information out. But here in 2014. The Duke Diet Doctor's Last Chance Diet, and then here on the right in 2021, we kind of made a new statement with all the internet keto going on out there, and net carbs and all that. I mean, that can work, but what we teach is prescription strength keto. It's a little stricter, but it's also stronger. And in there, and I get to be on the Zoom or this kind of internet connection with Judy. Judy told her story, lost 135 pounds, and got off 10 prescription medicines at 68 years old. Thank you, Judy, for telling your story in the peer-reviewed journal, the non-peer-reviewed journal at your checkout aisle of the grocery store called Woman's World. Well, so, I know now after studying and using low-carb keto diets that we can reverse and prevent many, many different conditions. And again, kind of to explain the transition for me, I'm reminded of a Robert Frost poem that I grew up with, my parents read, we sang a song in high school choir that was put to this prose, and it was the two roads diverged in a wood. And so here are the two roads. And it occurs to me that the well-worn path on the right is where everyone's going. It's the medication care. It's the doctors in the office prescribing things. They never ask you what you're eating and drinking in any great detail. And if you say you're doing a keto diet, they'll tell you they don't do it because it's bad for you. Of course, they have no knowledge that it's bad for you. So anyway, that's the medical care today on the right. It's bright, well-worn, and that's where everyone seems to be headed. But what about this other not so well-worn path on the left? And that's what I want to describe to you, is that at first I was skeptical and reluctant to kind of I can't really give up my association with internal medicine. I just can't prescribe medicines and then only take just a few minutes with people anymore. I have to talk about the root cause of problems. And in this case, lifestyle, and a keto lifestyle can prevent or reverse most of these chronic medical problems. So here you are, two roads diverged in a yellow wood. Which pathway do you want to go down? It's a new year. You can make a choice. And, the medication care on the right, if you're dealing with, you're heavy, you're dealing with extra weight, you're obese, you have overweight, then what you're going to find, the current medical care, medication surgery care, you might have done diet programs even on your own without a doctor. You might have been in food subscriptions and get food mailed to you. Even you pick it up, and then it becomes too expensive, and then a doctor will give you prescription medicines. And I've worked with a lot of obesity medicine doctors who prescribe pills and shots and all that. I mean, it's one way to do it. And then, of course, if a surgeon gets a hold of you, they're happy to make your stomach smaller or lop out half or 2/3 of your stomach. And that's kind of the current medical care of overweight and obesity. But it's not the only way to go. Now, something you might not know is related. Heartburn is a medical condition. It's a symptom, and it's kind of, doctors dismiss it as, oh, just take this pill. And well, you're often given pills that end up are found out to have medical issues and maybe even cancer years later, and then they get pulled off the market. So heartburn is managed by antacids and prescription medicines, and that's not the only way to go about it. Heartburn is one of those things. Almost 100% in the first couple weeks, the heartburn is gone. High blood pressure, you might not think of this as a lifestyle problem, but it is. And most doctors don't understand that either, and will put you on medicines and pills. And it just kind of, is disturbing to me that we'll measure a blood pressure at the office 2 or 3 times. And if it's elevated, we'll put you on a drug, and then we'll say you need to be on it forever. And even when I've had people lose 100 pounds, the other doctors are having trouble taking away medicine because they don't realize that lifestyle change can actually reverse these things. High cholesterol is another problem that doesn't always require medication, although that's the first thing a doctor is going to want to do, right? And in my area, I even have doctors who fearmonger their patients into wanting to put them on medicine for cholesterol. And I say, time out. Tell your doctor you're using lifestyle as a treatment for the high cholesterol, and say, give me a chance to fix it with lifestyle change. And you'll be surprised at how this can be fixed as well. You don't need to be on medications, even though there's a field inside of internal medicine, the Lipid Association, that all they do is give medicines for lifestyle medicines instead of lifestyle change for cholesterol. That's what they, again, it's what doctors teach and what doctors learn, and it's not the only way to do things. Type 2 diabetes is managed, and you might be told you have pre-diabetes and you get put on a medicine like metformin, and then when that stops working, and the doctor may not have even told you that you can reverse this, even so. If you're getting told you have pre-diabetes, you're a little bit going down that path to the right, it's time to stop, turn around, and go down. Well, maybe to go down the other side, this pathway. So you might then be put on pills and shots, and there are ones called Victoza and Byetta and Jardiance and Ozempic. And once you get put on insulin, which is a fattening hormone, you're going to be gaining weight. In the short run, you'll be controlling the blood sugars, blood glucose, but in the long run, you'll be gaining weight, which just compounds the diabetes and makes it so that it is irreversible if you're still on that insulin. And this is how the current medication care for diabetes. You might even be told that you will have diabetes forever. Of course, I'm talking about type 2 diabetes, the most common type of type 2 diabetes. Well, welcome to the reality that if you go down this pathway to the right with diabetes, it's not a great end place to be. If you know anyone who's had diabetes, and a lot of my patients have had loved ones who have gangrene, they have their toe amputated, they're below the knee amputation, they get kidney failure and dialysis, and might even get heart disease, have stroke, the neuropathy is numbness and tingling in the toes and all. And this is not reversed. It's managed with medications. And all too often, I'll get someone who's on 5 different diabetes medicines, and the diabetes medicine will just be given going up and up and up, and I can reverse it. So welcome to a world where we talk about carbs. I added that term down at the bottom there, sugars and starches. So if you're going down that path to the right, you're actually told to eat more carbs when you have diabetes. But what if we stop the diabetes and stop the carbs? We can stop the diabetes, and we can get you off medicine. So if you have type 2 diabetes or pre-diabetes, you need to know that diabetes is reversible. And one effective method that I teach is by not eating carbohydrates. Diabetes is a problem of excessive sugar in the blood, so you have no business eating anything with sugar if you have high sugar in the blood. And this was worked out 100 years ago and then forgotten because of the medications that came into the medical world. So what I do is I deprescribe, meaning taking away medicine. I take away the insulin, the Victoza, the Byetta, the Jardiance, the Ozempic, and you watch TV and there are even jingles for these medicines that go back to our childhood. That's a bit annoying. So we take you off the insulin. The diabetes is getting better when you don't eat the carbs. So you're starting to come back down the pathway here, turning the corner, and then you get off your medicines so you don't have diabetes. Now, it may take a little time. And for example, the one patient I talk about a lot, she's just a superstar. In 8 weeks, she came off 600 units of insulin for the diabetes, and the blood sugars were controlled in just 8 weeks. I had another gentleman who came off 160 units of insulin in 2 days because he stopped using sugar in the drinks, stopped drinking the cola that had sugar. So, of course, if you have medicines for diabetes or hypertension, you want to do this with a doctor or healthcare provider who understands how you have to take away the medicine. Sometimes I need to stop medicine on the first day of starting the diet, so that if you're in the clinical world where you have medical issues, medical problems, you're on medications, be sure to talk to someone who understands how this is impacted by the food change. And I don't want you to get sick by having the medicines becoming too strong. And that can happen because this is a very effective lifestyle change. So just by not eating carbs, I know it sounds crazy. It sounds too simple to be true, and I didn't believe it. And in fact, this is so unbelievable, you won't believe it. So that's why we have these challenges. That's why I have a clinic at Duke University where you can come and look me in the eye and yes, I'm real. Now I'm having people come to kind of just verify that I'm not just a YouTuber, and I actually do have a clinic. Of course, I'm sorry to say often there's a month or several month long wait to get into the clinic. But what we do in a world where there's no carbs, there's no diabetes, there's no pre-diabetes, there's no obesity, there's no metabolic syndrome, which is that high triglyceride, low HDL. So I don't worry about the LDL and the total cholesterol anymore. I worry about the new constellation of blood issues, which is the metabolic syndrome. There's no high blood pressure, no heartburn. It's pretty amazing. So getting back to that poem by Robert Frost, there are 2 roads diverged in a wood and I, and you may be faced with this. Do I go down this road of lifestyle? We can help you and teach you with what we know. In this Robert Frost poem, I took the one less traveled by, and that has made all the difference. So it just bringing home that idea that you don't have to do what everyone else is doing. And sometimes doing something that's just a little different can make a world of difference. And I wonder if maybe we can help you with changing your lifestyle and help you go down that path. So if this intrigues you, please, check out our information at Adapt Your Life on YouTube. Adapt Your Life Academy has opened, and we do this about every 3 or 4 months, has opened enrollment for our next Keto Made Simple Masterclass right now, so that you can join up and we can help you in real time. Again, the new year is a great time to get started. The Keto Made Simple Masterclass is a video class of me giving lectures, brief lectures, several hours. So it gives you the basics of why you want to cut the carbs down and how to do it with this method, getting started. And you can do it very simply, or you can make it complicated. But I'm really impressed that the internet keto today is very distracting. It's making people think that it has to be difficult and expensive, and it doesn't. In the class that we teach, there's no counting macros, there's no measuring of food, no need to test ketones with breath, blood, or urine. No need to use apps. If you use something like MyFitnessPal or Carb Manager or any of those things, it's just too much work. It's really just food, and like I mentioned, the real food is medicine, and I get to take people off medicines just by changing the food. And while some of the over-the-counter internet versions of keto can work, the method we teach is prescription strength. And what I mean by that is that it's as strong as medications, and it will work pretty much regardless of your metabolic state. If you have diabetes or high blood pressure or fatty liver, polycystic ovary syndrome, these medical conditions can actually be reversed, as I mentioned. One of the main things that we'll teach you is that we use total carbs, not net carbs, as the method of calculation. And that's just another way to get it to be a little stronger. And, it's not that net carbs doesn't work. It can, but like taking a Tylenol for pain, an over-the-counter Tylenol can work. But if you really have a strong pain, you will want to see a doctor to get prescription strength medication. So if you have any interest at all, we'll teach you and explain. If you want more information about what the class is and what it will provide, I invite you to check out the Keto Made Simple Masterclass. That's KMS, Keto Made Simple Masterclass, on our website, which is www.adaptyourlifeacademy.com. I'm sure someone's going to be putting a link in the chat there if you need the link. I look forward to seeing you there. I've told my colleague recently that I've taught more people now over the internet over the last 2 years since we started the Adapt Your Life Academy than I have at my clinic at Duke University. Because there's only so many people that can come in the door and sit in the room in the office. So it's really a pleasure. I have assembled a fantastic team of administrators who are all trained and have done this lifestyle for many years on their own. Again, I want to mention that the enrollment is only open for a few weeks at a time. And right now it's only open for a few days because we assemble everyone into one class, and we give all our efforts to help you stay on track and get started in the right way. Or if you need to restart, this is a great time to get into the support aspects that a lot of people really need. And that might be the difference between you trying this before and having success. Having that support group is really critical for many people, especially if you have the sugar addiction element to the food. If you crave sugar and have difficult time getting over the hump, getting rid of sugar, we can help you with that. Enrollment is now, and then we actually start in the support group next week. So you have time to watch the classes, watch the YouTube videos. There are PDF files with transcripts that we give the information in video form and also in written form, and then in real-time support form with lives during the 3-week session of internet support getting started. Well, I'd like to bring on Lisa Becker, who's the team lead at Adapt Your Life Academy. Lisa, are you all set? Yeah, thanks for being here tonight. It really comes to me over and over again that there's a choice. You can do what doctors tell you. How much have we heard? But my doctor said, or you can understand what good food does, and then make a change, and so much good happens.
So the AMA, American Academy of Pediatrics, is recommending surgery for obese children over 12 now.
Yeah, that's crazy.
It is crazy. It is
Well,
crazy.
it's common for me to talk to someone who's had weight loss surgery. Of course, I treat adults, and they never were told about a low carb or keto diet. The doctor said, just go get surgery, without referencing any of the medical weight loss components or interventions that we have. And having been past president of that organization, there are medicines, there are meal replacement programs you buy from the doctors, or there are prescription strength diets like the one I teach. And the medical weight loss is often not known about by family doctors or internists, and all they know or hear about is the surgery. There are a lot of people who just don't want surgery, which I totally understand. It's irreversible.
It's really sad when you go to the doctors these days and they don't even touch on nutrition. If you tell them you've got type 2 diabetes, they don't say, well, what are you eating? They are just so quick to put you onto medication and to put a band-aid over your problem. And it's just that's not what we do, and it's not what you do, and it's not what you've done for over 20 years in your clinic. So should we dive right into questions? We're going to answer a few questions tonight. Let's go for it. All right. And then, guys, if you have a question in the chat, because we are streaming into 8 different groups now, so questions are coming in from all over. We don't have a lot of time for questions tonight, but we will answer a few questions. So if you can use the hashtag followed by question, hashtag question followed by your question, then it'll help me to pick it up here in the chat. All right. Let's get to it. Mary says, what is the difference between net carbs and total carbs, and why do some people only count net carbs?
Yeah, so the effect of food on the blood sugar is what we're talking about really when we talk about carbs. And carbohydrate is the food that raises the blood sugar the most. Protein and fats don't really raise it much. So if you're going to be measuring the amount of carbohydrate you eat or drink, using a grams per day is a good way to measure it. I mean, you could do teaspoons of sugar or something like that, but I prefer, just because we have labels that tell us the grams of carbs, to have people just look at the carbohydrate grams. The total carbs means that all of the carbohydrate inside the food or drink is included in the number that you're using, if you're using a number to stay under for this kind of low carb approach. So the idea is we want your body to start burning fat. If you don't eat the carbohydrate, your body is going to start burning fat on its own. And so the net carbs came along, right around, 2005, 2010, as an idea of, a lot of people don't metabolize the fiber, they don't absorb it, or they don't metabolize the sugar alcohols the same way. So let's deduct these sugar alcohols and fiber from the total carbs, say they don't count. So what happened is that there are a lot of bars and shakes and things that say net carbs on them, even bread that says 0 net carbs, assuming that you don't absorb the fiber and the sugar alcohols, the other sweeteners. Some people do absorb those. And so, again, my approach is to not assume that you don't absorb them. It's to just count them as the total. And what a total carb program does as well is it minimizes the keto junk foods that are out there now. You can actually look for keto cereal, keto ice cream. They're not really keto. I mean, there's no keto food. Keto is a metabolic state of fat burning. And it's just a way to get your body to burn its own fat. You can do, I saw someone talking about low-fat diets. You can do low-fat diets, and Don, I think, Don, you're being a little bit of a troll in that you can do low-fat diets. It's fine, but a lot of people that doesn't work for, or they choose to do a low-carb program because they've tried a low-fat one and it didn't work. But I have no problem if you're successful on a low-fat kind of program. More power to you. When someone has a lot of weight to lose, or they have type 2 diabetes, then keeping the carbs super low and using total carbs is the most effective way to get your body to burn fat. I mean, this is now in several guidelines by the American Diabetes Association, for example, the Obesity Medicine Association. So there are a lot of ways to be healthy, and this particular way is prescription strength.
Okay. If you see a troll in the chat, just ignore them, and we'll just continue.
I'm sorry.
I don't think that we can take them out, unfortunately, but just ignore them. All right. Colleen says, I have hypothyroidism. Is the keto diet good for that?
Yeah. Well, I don't think it reverses hypothyroidism, but certainly I've had many, many people with low thyroid being treated for the low thyroid, and they are successful on a low carb and keto program. So I don't know of any kind of lifestyle that actually fixes or reverses thyroid problem. As you saw, that wasn't part of my pathways lecture, but certainly we monitor that, and also this kind of program will work even if you have had low thyroid, hypothyroid issues.
Okay, great. Max says, I've heard you talk about internet keto versus your method of keto. What is the difference?
Yeah, so in our Keto Made Simple Masterclass, where we're teaching people over the internet, which is open now for enrollment, we've surveyed the people who've come through the class, several thousand now, and
almost 7,000 actually.
7, thank you. Time flies.
I know.
So we survey folks. We want to know what the success has been. So we tabulate the weight loss that people had, and also we ask for my teaching purposes, basically, what was the difference between what we taught and what they learned from the internet. And so there are at least 10 different things that are focused upon on the internet that we don't really worry about in our class, that makes it simpler. And it's still, in fact, it's more effective because we're using total carbs and not net carbs. And, probably the most common thing that we've seen that trips people up on the internet keto when they're trying to lose weight or reverse diabetes is too much fat. So there's this kind of idea that you can eat unlimited fats. It has no carbs. But it has lots of calories, and the fat that you eat is going to be burned before the fat off your body. So that's a big part of the education, is that you have to burn through the carbs that you're eating. That's why you want to keep them super low. You have to burn through the alcohol too. That's why you want to moderate alcohol. It's not forbidden, but you want to moderate it. And then you actually have to burn through the fat that you're eating and drinking before your body is going to give up its own fat. So, pearl number one, if you're doing internet keto and it's not working for you, is be mindful of the amount of fat and oils and cream and mayonnaise and cheese. These are the items that people consume enough of so that it doesn't work for the weight loss or diabetes or metabolic reversal.
And then I see Deborah has asked in the chat, and I just want to say definitely not. Deborah, she wanted to know if she's on medications, can she wean off them herself? Or should she go see a doctor?
Well, see a doctor, definitely.
Definitely see a doctor.
We can advise you at times when you need to see someone. So if you're on some medicine, we can teach you in the class, but we can't manage your medicine at a distance, unless I guess there are times when I've treated people who are nurses or doctors, and and they understand the measurement and monitoring. But for the general person who doesn't, is not medically trained, you don't want to do this on your own if you're in a clinical sort of situation of medications, medical problems like diabetes and high blood pressure.
And then we've got 2 cholesterol-related questions. So Pat first says, in your masterclass, do you teach anything about cholesterol? That's the first question. And then do you want to answer that first?
Yeah. So cholesterol, of course, is actually necessary, and so we teach that actually you need some cholesterol in your diet, and then there's a shift from the old way of just looking at total and LDL cholesterol and treating it with medicine to looking at the triglyceride and HDL and the blood sugar and the blood pressure and the abdominal circumference. That's called metabolic syndrome. And so we explain what that is, help you understand how to measure that and monitor it over time. But again, you're going to be treating and reversing cholesterol issues by changing the lifestyle.
Right. And JP's Eyebrows, I love that name. That's the name of JP's Eyebrows, is on YouTube. Can keto help with ED?
I suppose possibly.
What is ED, first of all?
Well, I guess you mean erectile dysfunction.
Okay, yes.
Or emotional disorder. No, well, so
both of them, I guess.
Yeah, and I think it's the weight loss that helps, although there's a signal that insulin resistance is a mechanism for ED, and there's no question this kind of approach reverses insulin resistance. That's kind of the precursor to prediabetes and diabetes. But I don't know of any publications that document that. And so it's going to be kind of an anecdotal sort of knowledge at the moment.
So the next question about diabetes was, should I worry about high cholesterol? My total cholesterol is 280, HDL 100, and triglycerides 80.
Yeah, so I can't advise you based on blood tests like that. So I wrote a course for the Adapter Life Academy on cholesterol, and we'll have that open again at some time in the future. But that is just not enough for me to comment on your entire cardiometabolic risk. And I would never advise you to be on a pill or not a pill or what to do without knowing, at least 5 other parameters about your health. I can't just comment on a blood test.
Molly says, I know there are 2, I can answer this one. I know there are 2 components to the Keto Made Simple course. I saw on your website. Can you explain those, please? Yes, Molly. So yes, there are 2 components. So let me explain how it works. So as Dr. Westman said, this is an online video-based training program, but it also includes 3 weeks of private group support. So component number 1 is when you enroll up until the 13th, because we close enrollment on the 13th, you will immediately get a welcome email, and you'll get access to your own student portal that contains all of the lessons, Dr. Westman's lessons, and a few great PDF resources inside of your own private student portal. That's password protected. So that is component number 1, and then that's yours to keep. So once you enroll in the class, you can look at those lessons 6 months from now. It's completely yours to keep. And then the 3 weeks is actually the live component of this course, which is that actually starts on we start getting you into this Facebook group, and I'll tell you in a minute, you don't have to have Facebook group to do this course, because as I just mentioned, you get access to a student portal with all of the lessons in. But if you want that support component, then you can join us in a private student only Facebook group for the 3-week period. And And in there, we get started January 16, where we start funneling people into the group. And then day 1 of the 3 weeks starts on Wednesday, January 18. And then we end on February 8. And what's incredible about this particular group, first of all, everybody that's inside of this group is doing the course at the same time as you, but we will have live sessions in this group. We will have live Zoom sessions. So even the people that are not in the Facebook group obviously can participate. We will have, there's a lot of fun things that go on in this group. We have theme days in the group. If you're not in the Facebook group, we also do send the ability to submit your questions ahead of time. So Dr. Westman will be live on Mondays, and Amy Berger, our nutritionist, will be live on Thursdays at 8 p.m., I believe. But everything is recorded. So even if we have people from all over the world taking our course. So if you're in a different time zone or you can't join us, we will send you the replay the next day via email. So those are the 2 components. And again, if you go to our course page on adaptyourlifeacademy.com, you'll be able to see everything that this course entails. There's a full overview, how the program works. You can even see the actual lessons, what you'll learn, what you'll get, meal plans, recipe book, blah, 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 and blah, blah, blah. So you can see all of that on the course page. Again, just to remind you that enrollment does close on the 13th, and then this course will be available again. We only run it 3 times a year. Probably at the end of June will be the next time that we offer this course. Let's see. Jim says, I have a big sweet tooth and I can't seem to stay away. I've heard that food cravings go away quite quickly. Is that true?
Yes. So if you're craving sweets and you understand the health consequences of having those sweets, then we got to get you off them. The interesting thing that we teach that a lot of people don't on the internet is that we will teach you how to use non-sugar sweeteners. And it's just amazing how strong that is in people's minds about, well, that's worse than sugar, isn't it? No, it's not. And in our method and methods that have been used for decades now, the use of non-sugar sweeteners to get people off sugar is an important part of a successful program. So yeah, we don't allow unlimited fats, and we allow the non-sugar sweeteners to get you off sugar, so that actually you're going to be having sweet things. It's just not sugar. And what happens is that your body and your brain unlearns that association between the sweetness and the reward that you were getting from the sugar. And in some people, it's as quick as 2 days. They're not even missing the sugar anymore. And I remember someone said to me in a class, no fruit, no fruit. It was lamenting the idea that, and within a couple of days, the cravings were gone because she wasn't having it. And the obvious kind of thing is that you crave what you eat.
Yeah.
So if you stop eating something, the cravings go away, and it's remarkable how fast that happens.
If somebody comes and visits you in your office in Duke, do you would they receive guidance with medication adjustments? Is one of the questions.
Yes. So if you came to me at Duke, or you went to any of the other obesity medicine association doctors around the country, there's an initial visit, just like you were seeing a specialist, so that we take time to hear your story, get to know all of the medical and surgical, past medical issues that have been there, your current medications. I even touch on your current social history. Do you live with a carb eater? Do you get support, or do you anticipate antagonism from the people you live with? I mean, sometimes that's the the teaching and all is great, but it's the little thing that makes it not work is that there's someone not being supportive. So it's an interesting kind of practice. And we also do the medication review, do laboratory testing if needed. And there's a set of labs that we consider. Most people in our area have had these labs tested by other doctors. It's just the other doctors didn't know what to do to fix the medical problem. But yeah, I can adjust medicines, but I have to have had that whole background in order to do it safely.
Thank you, Dr. Westman. So just in closing, this class, if you have been feeling frustrated and disappointed on keto, on internet keto, or if you've been in groups or on YouTube and there's so much conflicting advice, this course will really give you what you need to succeed, and a science-based program that is not based on 80% fat like you see on internet keto. It's just really, we keep it simple, and it's just simple, easy food that you will actually be able to sustain long term. So
that makes me remember someone who was able to be successful because he understood how to eat a keto diet at fast food establishments. Now, I don't go to these places frequently, but if I'm traveling and or driving somewhere, or the family wants to go somewhere. So this gentleman actually lost 100 pounds eating at McDonald's. I mean, not to name any name, but so there's this weird fear of fast food when really what you do, spoiler alert, what you do is you eat there, but you don't eat the carbs. So actually, this gentleman figured out how to have cheeseburgers with no buns, no fries, and no sugar in the drinks. And so what we teach is a flexible method that allows you to keep it simple. And that's kind of the frustrating thing for me, is people are now thinking a low carb keto diet's hard to do, when it can be very simple.
well, on that note, thank you so much for your time, and thank you all for watching, and hopefully you join us in the class again. Go to our website, adaptyourlifeacademy.com. I don't want to sound like an infomercial, but this course is open now, and we would love you to join us.
Thanks a lot, Lisa. Really appreciate that.
Okay. Thanks, everyone. Good night.
Bye now. Bye.
Bye.